Today, as per the request of the students, doctors, I'll discuss some of the remedies in relation to menstrual problem. A of course, they were all female complaints, but then it's a long list of menstrual complaints of uterine fibroid and related to infection and fallopian tube problem. And I'll just discuss the menses problem because this was a question which was asked by a lot of doctors. I'll discuss whatever I see in my practice. There are a lot of remedies in relation to menses, like menses only for one day, and menses in the morning, or menses in the evening, and menses in the night. Of course, these are the symptoms which are present in our mater medica and in patients, but I'll discuss only those cases or symptoms of the patient which I have seen more in my practice. Okay, for example, a very interesting case of menstrual problem came to me. The patient was suffering from irregular menses, and the patient said that it is normally irregular, but sometimes it becomes regular, and it is whenever it comes, I am happy that it comes in the day, so I have the whole day to work then. So when I took the case, I had the remedies. I prescribed patient causticum, pulsatilla, but it did not relieve. A very interesting, case, it was a case where I asked the patient about some problem. She had a problem of the gastric gastritis and all, but there was one symptom which was very common in that case patient, was that menses only in daytime. And surprisingly, I prescribed the patient Abis nigra, and the patient got the menses properly, the flow was proper, and the cycle became regular. Abis nigra. Why I'm telling this remedy? Because normally in female complaints, I'll just come to you, Dr. Bilwalkar. In female complaints, we normally think about remedies like pulsatilla or lilium tig or sepia, sabina, thalaspi, trillium, calca, a lot of remedies. But Abis nigra, which I also was very surprised, cured the case. I'll go to the other symptoms. I'll ask the question. I'll answer the question first. Dr. Bharti, good afternoon. Dr. Vishaka. Fracture neck femur. Now, post-COVID, I have a lot of cases of, what you call, avascular necrosis of fever. And let me tell you, very, very good results with homeopathy medicine. Why I'm telling you this? Because in allopathy medicines, there is actually no as such cure for avascular necrosis of femur. And in homeopathy, we have a very, very interesting symptoms related to AVN and related to cure of AVN. Okay, so let us again, there are a lot of, there's a lot of disturbance here in the YouTube. So let us, I'll just tell you what I prescribe for that. Avascular necrosis, welcome Dr. Babel. Avascular necrosis of femur, basically, if it is post-COVID, remember, I always tell you, I have basically a lot of, patients after COVID, which I basically start my treatment with COVID-19 vaccine. This COVID-19 vaccine, 30 potency, have given me tremendous results, even in case of AVN. Whenever basically I start the treatment, if it is post-COVID AVN, I make sure that I start the treatment with COVID-19 30 potency, and then after taking the whole case, I have got the results. I had cases of AVN where it was grade 3, and now after the treatment, the patient is in grade 1, and there are some patients who have been having normal femur architecture. This is whatever I have seen in my practice. The remedies which I have used in my practice is, of course, I start always with the what you call COVID-19. Then I have remedies like Calcarea silicata, which I give, and it is have fantastic results. Then I have remedies like Merxol, which also have good results. I give Calcarea carb. I give Asafoetida. I give radium brome. I give natrum mure. These are the remedies which I have used in my practice with very good results. Of course, starting with COVID-19. Okay, and good results. The pain goes, the cramp goes, the patient is able to walk properly. Of course, I always ask the patient not to sit, because when the patient sits, I have seen, or the complaint relapses fast. So before he starts getting better, I tell the patient not sit, so that it gives rest to the joint. Okay. Let us go forward. Yeah, Dr. Barbal, welcome. Dr. Navjot says 75-year-old male having right thigh pain only when on bed at night. It starts after midnight, standing and Rastos given. No. This is basically a case where Rastos will not get relief. It is a syphilitic complaint. No, if you open a Mater Medica or syphilitic complaint, if you open, you will see the first remedy syphilinum. You have to start the case with syphilinum, give syphilinum 1 m single dose, and then you can wait and see how is the result, and then automatically start giving the medicines. If you open the Mater Medica, there are a lot of remedies. You can think of syphilinum first. Second, there is somebody who's disturbing the chamber 6, writing stupid things. Okay. So syphilinum, then you can think about Cilicia, then you can think about Calcarea carp, then you can think about Muxol, then you can think about Pulsatilla, Sorinum, Ferrum Phos. There are lots of other remedies for that, but Rustox won't help in this case. Okay. So let us go forward. Dr. Joshi says nodular lichen planus. Lichen planus, of course, it's an autoimmune disorder. It is a syphilitic miasm. So whenever there's a syphilitic miasm, you have to see what symptoms syphilis the patient is suffering from. Syphilitic symptom in that patient. That is very, very important. For example, if the patient is suffering lichen planus and he has a problem that lichen planus has become ulcerated, lichen planus has become is bleeding. Sometimes there is a secondary infection. Syphilitic part. If you have a syphilitic symptom, then you have to prescribe on that. Of course, I can't tell you the remedies for that, because normally if I have cured lichen planus, I basically see the syphilitic part either in the mind or in the body. If there's a problem of elements from mortification, abuse, self-doubt, then also it is important. Or if there's a problem of very much dominance in the part, this is a very, very important thing which has to be taken care of. Okay. Let us go forward. So I was telling about the bone problem, Dr. Navjot. So syphilinum is a starting point. And second, we have Cilicia, Muxol, Calcarea carp, Asafoetida, Sorinum, Ferrum Phos, lot of other remedies which can be taken care of. Okay. So let us go forward. Yes, can we go forward? Yeah, so I was talking about the menses part in female complaints. Now I will talk something more. Daytime Abies nigra. If you move forward, there are patients where the patient comes and tells you that the stools basically are because of hard stool. There is menses, and this will be a lot of patients who will tell you that after hard stools the menses starts. There are a lot of remedies, but two remedies which I have seen very, very important in my practice. First is ambragracia. Ambragracia, because ambragracia, I have never failed when I have given ambragracia with this complaint. So first is of course ambragracia. Second remedy that you should think about is lycopodium. Whenever the patient complains that the stools, because of the hard stool, the menses are there, you must think about ambragracia and you must think about lycopodium. This is the second part which I've seen in many of cases in my complaints. Third thing, sir, approach for good. Okay, patient has constant stress from husband, alcoholic problem, lichen planus with severe itching. See, there's a difference between constant stress, a constant dominance, and constant admonition. There are three things. So you have to be very sure when you're prescribing, is it because of stress, it is because of admonition, it is because of domination. One thing also, there's one more rubric that will be very much surprised, that is tormenting. Sometimes, the husbands are so tormenting, do this, get up in the morning, wear such type of clothes, don't wear this type of clothes, cook this food, look to my mother, look to my father. He torments. So there's a rubric for tormenting also. So you have to be very sure which rubric you are using for the case. In homeopathy, rubrics are so close together, you are not able to differentiate. For example, dominance, we can have carcinosin, we can have Lycopodium, sepia, folliculinum. For tormenting, we can have calcarecum, zincum metallicum, sorinum. For stress, lot of remedies. So first I have to differentiate and then we can go forward. Okay. Approach for PCOD. See, PCOD is a hormonal problem. So you have to understand now, Jyot, where is the hormonal disturbance started from? If you understand that the hormonal disturbance has started from this problem, then you can pinpoint that. And let me be very frank, treating menstrual PCOD is very simple. One or two main symptom and the patient basically is cured. I have a lot of cases of this, but let me tell you one thing is very, very important, that in PCOD case, the patient should not have secondary symptoms. Like if it is, if it is polycystic ovarian syndrome, then you have to think one thing more, that you have to take everything into account, that symptoms from systemic symptoms as well as the menstrual symptoms. For example, if the patient suffering from hirsutism, if the patient is suffering from menses problem with vomiting, diarrhea, nausea, these symptoms are very, very important. So this you have to take into care of. Okay. Kindly make live session twice a week. Okay. Thank you, sir. My focus is very poor. I cannot concentrate on a single thing for even a minute. See, Dr. Akash, if your focus is very poor, as such, there is no remedy for focus. That means you have to find out why the focus is very weak. You have to find out why the focus is very weak. There are a lot of remedies like chaotic है, confusion है, mistakes है, बहुत सारी चीजें हैं. So first of all, you have to identify why is the focus weak or changeability है. Then we can proceed to some remedies or some symptoms. Okay. Joint pain, post-viral fever like chikungunya, medicines please. Yeah, Dr. Padya, there were so many things, of post-chikungunya, a lot of pain and all. Let me tell you some of the very interesting remedies, very rare remedies which I have used in my practice. Please write down. The first remedy is Hymuza. You must have heard the remedy Hymuza. I've prescribed Hymuza for post-viral, post-chikungunya pain and it has given me very good results. I have prescribed Hymuza 1M single dose, repeated after 3 days, 4 days, depending on the consistency of the reaction of the patient. Second remedy, which has also given me very good results, that is paracetamol. There's a remedy called paracetamol in homeopathy, potent as medicine. 30 potency has given me good results. Third, of course, we have Rustox in LM potency. I have started from 0/7 post-viral, post-chikungunya. Fourth remedy, again, it is not so prescribed, but I have got good results. That is gelsemium. And fifth remedy, sulfur. Of course, sulfur is indicated for everything. If nothing give results and it is post-viral, suffering from skin complaint, then you have to think about sulfur. So these are the problem. These are the remedies which I have used very frequently with very good results. Of course, in chikungunya, if there is a very specific symptom, then you have to think of some other remedies also. Okay. Tailbone pain, age 27 years. Yeah, Mishra ji. Tailbone pain, very important. The first remedy that you should think about. The first remedy is, of course, for coccinodioma is, concoderma is hypericum. If you open your Matermedica, hypericum is the first remedy, and that is very, very important. But if you open Matermedica and see symptomatically, coccinodioma, when the patient gets up from the chair, you can have hypericum, you can have sulfur. Coccinodioma because of some trauma, you can think of arnica. Coccinodioma, if the patient has so much pain, the patient cannot sit also, has to bend backward when you have to send. Rustox. In this case, one thing is very, very important, Mishra ji. The patient has to sit on a pillow, donut pillow बोलते कि पीछे से कटा हुआ रहता है. So the gravity effect of the coccyx bones is taken care of, or you can use a tube, गाड़ी का ट्यूब से भी हम बैठ सकते हैं इसके अंदर. This is very important in treating coccinodioma. Okay, I hope I'm very clear. So if you understand something, you just give me one, so that I'll be able to understand that you're understanding what I meant to tell you. Let us go further in menstrual complaint. There is one more symptom where I have used this remedy and very, very good results. Lot of people, ladies would come and tell you that we have menses problem, and when the menses problem starts, our urinary problem also starts. So when this is the complaint, you will be surprised that Berberis vulgaris has given me very good results. In homeopathy, which symptom comes is very, very important with the menstrual complaint. For example, some patient would tell you that we have menses problem, and when the menses problem starts, our urinary problem also starts. So when this is the complaint, you will be surprised that Berberis vulgaris has given me very good results. In homeopathy, which symptom comes is very, very important with the menstrual complaint. For example, some patient would tell you that in menses complaint, whenever I start walking, my bleeding aggravates. So menses complaint with urinary problem must think about Berberis vulgaris. Menses complaint and the patient starts walking and there is a lot of bleeding increases. So you can give me the answer. Before that, I'll just answer one question. Sir, in case of high grade fever with upper respiratory control, till how many days we can wait with our medicine? Yeah, Dr. Sonam. So it is not basically, it is not important that how many days we can wait. It is important that after the medicine, how is the patient reacting to our medicine? Okay, if the patient has started feeling better, then automatically, that will start regressing. So days is not important in homeopathy. How is the patient reacting is very, very important in homeopathy. So you can look into the matter through this concept rather than days. That's not important. Sir, severe epistaxis with raised BP, patient 75 years, male, bleeding, take hospital, nose bleeding is done for 48 hours, bleeding concerned after day and walking. First of all, in this case, Navjot, you have to think about one remedy which is very, very important. In this case, that is millilotus. I have seen very, very important epistaxis with raised BP. Millilotus has given me very good results. Think about millilotus. Second, you see how is the bleeding. It is bleeding is reddish. It is with clots. It is blackish in color. Depending upon that, automatically you will prescribe the medicine. This is very, very important to understand the quality of blood because this would guide you to the remedy. Okay. So let us go further. Dr. Navjot, I hope you got some results. Millimeters, because just now, I just had a case and I got that case. So it is very fresh in our mind. One urticaria of finger immediately after contact with dust, handling anything of dust. See, whenever you have this type of symptom and you want to prescribe only on the local symptom, in this case, 3 remedies very, very important. One remedy is called as cotyledon. Second is histamine. And third remedy which I have seen in the practice is arsenic album. This is for any allergy if it is there. Okay. Medicine for dehydration, Dr. Rahul, I don't know. I have never prescribed for dehydration. I would say hydrate the patient with some fluids, coconut water, fruits or water simple with buttermilk, and that would be better. Okay. It is red and fresh blood. So whenever it is red and fresh blood, the 3 remedies you should think about. The first is automatically phosphorus. Phosphorus is very, very important. I have seen very good results with phosphorus. Second, will be surprised. I have also seen good results with pulsatilla. Pulsatilla has also given me very good results. And third remedy again. Now see, this remedy is not so commonly prescribed, but I have still got very good results with that. That is belladonna. These are very, very important. Dr. Joshi, Dr. Devangi, yeah, your husband had come last Sunday and very happy that sugar was going down, and he's also happy and you also very happy. So nice. It's very happy. I'm very happy that doctors get relief with homeopathy because the confidence you get after you treat a doctor or a doctor is being treated. Otherwise, they feel that homeopathy does not work in chronic complaints. But very, very happy that you are better with that. Thank you so much. It is red fresh. Okay, so we have completed that. Let us go forward. Okay, I was telling you something about menses which is aggravated by walking. So think about pulsatilla. Pulsatilla comes in everything, but there are some remedies. Walking aggravates is very, very important. You have to use this remedy in your practice. I have seen so many patients. I have prescribed only this complaints, and have given me very, very good results. Which are the remedy? First is pulsatilla. Anything which comes in your mind? Anybody? You have to have something. This is a very common elements which I have got a lot of questions on. That's why I'm telling you this. Anything else? Anybody? Menses aggravation walking. Yes, anybody? First is pulsatilla. Second is sabina. Sabina has given me very, very good results. Very, very good results. Of course, there is one question on Leucorrhea also. I'll just go there. Third remedy, magnesium carb. And fourth remedy is zincum metallicum. Very, very good results we have seen in that case. Now, Leucorrhea. Now, first of all, if the patient of Leucorrhea comes to you, ask simple, how is the Leucorrhea? It is thick. It is what you like. If it is thick Leucorrhea and if you have got no symptom in the patient, please give the patient hydrastis. I have given hydrastis just by simple Leucorrhea thick, hydrastis and Calibaculum works beautifully. Of course, there are other medicines also like calcarea carb, like arsenic, like uh, sabina, like sepia, but hydrastis and Calibaculum, very good results in my practice. Okay, now thin. Now thin Leucorrhea. Think about pulsatilla, think about nitric acid, think about graphitis, and think about sulfur. So you have to differentiate. Immediately ask this type of question: is thick or thin? And then the patient would say, no, it is neither thick, it is neither thin, it is rope-like, ropey, tenacious. Then again think about hydrastis, calibichrome, nitric acid and sabina. Both thick, thin, both remedies, then you can give this. Then you have to ask, there are a lot of rubrics and symptoms, starch like boiled starch, stiffening the linen. That is very good to read, but I have not got good results by asking the patient, because the patient is confused what to tell to the doctor. So don't make the patient confused. Okay. Now, staining the linen. This the patient will tell you. The Leucorrhea is staining the linen. Very, very important. First, staining, then ask how is the stain. Staining the linen, you must think about mercury, Merxol. Second is sternum metallicum. Third is pulsatilla, Naxomica, China, Lilium tick, and Lachesis. It is staining the linen. So this is basically which I ask. I don't ask that types, starch like, boiled like, there are other remedies, but the patient has difficulty in explaining how it is. Then we prescribe and we don't get the result. Second thing, ask in relation to menses, like before menses, during menses, or after menses. If the Leucorrhea is before menses, see, pulsatilla will come everywhere. You must be able to differentiate. Pulsatilla is there before menses, sepia natrum carb. Natrum carb is a very good remedy if the menses is, if the Leucorrhea is before menses. Very, very important. Okay. Now, Leucorrhea after menses. The remedies which I have used in my practice, first again, think about zincum metallicum, but trillium pendulum, you must have never heard trillium pendulum, but trillium pendulum, Leucorrhea after menses. Trillium pendulum, nitric acid, sepia, and colocin. This is very, very important. Then ask the color. Simple, I ask, either color is white or color is yellow. Red color menses, of course, it is there, but it is very sporadically present. So white in color. If it is white in color and the patient is very able to describe it properly, think about natramur, think about borax, think about graphitis, think about sepia. Very, very clear. The patient ask symptoms what the patient is able to tell you very correctly without any confusion. Then you'll be able to prescribe very properly. Then think about, then ask the patient when if it is white, then ask when it is more, in the morning, in the evening, in the night, and then you can able to differentiate. Okay. Then Leucorrhea yellow. First, if Leucorrhea is yellow in color, creosote, calcarea carb, hydrastis, arsenic, sepia. If you see my answering, there are some remedies which are very repetitive. Pulsatilla, hydrastis, calibichrome, nitric acid, sepia. These come very repeatedly in our prescription. So you have to be very shrewd and witty in differentiating this. Okay, so this is about Leucorrhea. Now something about menstrual. I have told you something about menses which I forgot because there were a lot of questions. That's why. Very, very important. There will be some cases in your practice which will never give results, so you'll be confused what to give. Then ask about the moon phase. Menses at full moon. Menses general at full moon. Nitric acid, Naxomica, calcarea, and at new moon, Silicia, Staphylococcus veratrum. Very, very important. This is so many important because these are very simple things that you have to remember, so that this symptom you don't miss in your patient. We have patient, putting the hands in cold water, in milk, drinking milk, and it suppresses the menses. There are a lot of good symptoms in mater medica, but in practice, whether you will get or not, hardly sporadically. Okay. Now, if there is no menses absent, the patient comes that I have not got menses. Simple because of weakness, my dear friends. Very, very important remedy, Parthenium. The remedy is Parthenium. Because of weakness, there is no menses. If you open the repertory, it is written menses absent in feeble woman, in hysterical woman, in nervous woman. So in feeble woman, differentiate between a feeble woman and weakness, sepia. Hysterical woman, silicea. Nervous woman, arsenic album. So this is how you differentiate. Then the color of menses. If a patient comes to you and the patient comes out, of course, this is very, very rare, but I am telling you, menses black. The patient comes and tells you the menses is black in color. Don't give pulsatilla first, don't give sepia, first give cyclamen, my dear friends. Cyclamen is a very, very important remedy, cyclamen. Menses black. Elapse. Just ask the patient whether the patient likes buttermilk, that is elapse. Third remedy, magnesium sulfate, where the menses is black in color. Exactly opposite, menses is bright red. Dr. Najot says fresh blood. Menses is bright red in color. Erigeron, millefolium, ipecac, and phosphorus. You will never fail when you use one of the medicines for bright red menses, though temporary, but that will give results. One of the four medicines I have never failed. So black and bright red. Of course, then you have menses, brown in color and bluish in color, and but difficult for the patient to tell you. So we'll not take that. Now clots. Menses clotted. Ask the patient how is the clot. First of all, dark and clotted. So whenever the menses is dark and clotted, think about sabina, think about belladonna, my dear friends. Think about platina, think about lilium tick. Menses is dark. And how is the clot? Large or small? Large, the patient says, एक ही निकला, बहुत बड़ा निकला. One and was very big. Think about a very, very rare remedy, doctor. Pituitary anterior. Pituitary gland, a very interesting remedy. Whenever I fail in menses and the clots are large, and I have prescribed the patient ipecac, I have given the patient pulsatilla, natrium, no good results, then I prescribe anterior pituitary gland in 200 potency, and I have got very good results. Okay, so large clots. Then, of course, ipecac, pituitary, stramonium are there, and then ask the patient whether it is offensive. If the menses is offensive, belladonna, sickle core, crocus sativa is very, very important. I'm just telling you fast because there are so many permutation combination in menses. I'll not be able to complete, but there were so many questions for menses coming. I was just sharing my knowledge. The pencil, see, there are no color of menses green, color of menses gray, color of menses brown, glary. I have not seen so many times in my practice, and the patient has difficulty in telling. Don't ask. Second, sometimes the patient will tell you the menses are hot, garam lagta hai. Again belladonna, again pulsatilla, again silicea. Very, very important. Okay. Now, menses irregular, very, very late. Now, don't count the days. 8 days late, 5 days late, 6 days late, 10 days late. We have remedy for everything. But if the patient has very, very particular that, okay, menses are always 6 days late, you can think of that remedy. But late menses, think about graphitis, nitramure, pulsatilla, sepia, silicea, causticum, dulcamara, macab, lot of remedies. One symptom there you have to remember, the menses are long lasting. डॉक्टर साहब एक बार शुरू हुआ ना, पता नहीं कहाँ खत्म होगा. Once it starts, we don't know where it ends. My dear doctors, think about Nux vomica and calcarea sulf. Just to differentiate between Nux vomica and calcarea sulf, in calcarea sulf, the patient would say the menses is long lasting with headache. The patient says menses is long lasting with headache. Then the only remedy is calcarea sulf, my dear friends. Calcarea sulf. Hello, are you with me? I am only speaking and no response from you all. Anybody? Are you happy? Are you understanding? Otherwise, you can ask questions and I can always answer you after that. Okay. Just give me some notification that you understand. Otherwise, I feel I'm talking to the computer only. So now menses from there's a question. I'll just complete this thought. Menses painful from fright. Doctor Sahab, yesterday, what happened? I was just going, I saw the accident, I got scared so easily, and the menses started, and it is so painful. I cannot wake up from my bed also. It is so painful. I have taken 2 painkillers, no result. My dear friends, you must have never prescribed Aconite. Aconite 1M or LM potency start directly from 0/8 has given me very, very good results, my dear friends. Aconite. Okay. Let us go forward. Menses, of course, there are a lot of other permutation combination. One thing you must remember, when the menses are very profuse, trillium pendulum, thalaspi, sabina, sickle core, senecio, lot of remedies. Okay. Okay, so already half an hour up. And thank you for your participation. I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you. Until next Saturday. Goodbye.